Hi, everyone, and welcome to this week's What's Up Wednesday. My name is Rachel, and today I'm joined by Melissa Buchholz with Assuring Better Child Health and Development, or ABCD. Melissa will be going over how to help supporting a child's development. Hi, Melissa. Welcome, and thank you so much for joining me today.
Hi, thank you for having me.
Melissa, why don't you start us off by introducing yourself and briefly explaining your roles with ABCD and Healthy Steps?
Sure. So I'm Melissa Buchholz. I'm a clinical psychologist by training, and my role with ABCD is that I am the director of Healthy Steps here in Colorado. ABCD is the state intermediary office for Healthy Steps, which basically means we work very closely with the national office, and I'll talk about Healthy Steps in a little bit, for this evidence-based model and our Healthy Steps sites in Colorado. And ABCD, for those people who are not familiar with ABCD as an organization, is an organization that's been around a long time, 16, 17 years. And our mission is to partner with and build connections across healthcare, community, and early childhood partners and systems to expand best practices with the vision that all Colorado's children have access to services that promote healthy development. So Healthy Steps is one component of what we do, but our main goal is to support children with reaching their optimal development and to support the providers and families to help them get to that place.
Okay, awesome. What a great resource.
Yes.
So, what role do primary care providers play in supporting child development, and why should other professionals prioritize communication and collaboration with primary care providers?
Well, primary care providers are really key. They're a key player in young children's lives. We know that about 97%, so a huge number of families, bring their children to the primary care clinic early and often in those first even days and weeks of life. So often primary care is the first stop that families have, first professional stop outside of the birthing hospital to interact with a professional who has expertise in child development. Families often come to primary care first when they have a question about their child's behavior or any kind of developmental concern. They might show up there first because there's actually a positive stigma with primary care. Primary care providers are seen as helpful and supportive and positive, not a negative stigma. So families are excited to take their kids for their well child visits and for anytime something comes up that is concerning to them, whether that's a medical question or a developmental question. So coordination is really important because of the role that primary care providers play in young children's lives and in their families' lives. And it's important to coordinate with primary care because they often are seeing families before they show up anywhere else. And so they may have a relationship that's been ongoing for months or even years with the family by the time another professional has an opportunity to interface with that family. So if you are a professional working in a childcare setting or a home visiting setting and have the opportunity, I would encourage you to coordinate with the primary care provider. And we can talk about some ways to do that, but we know that it's important that the primary care provider has an understanding of the context in which that family and that young child exists in. So if they are a student in early Head Start or in a Head Start program or in a childcare setting, it's helpful to that primary care provider to understand what's happening kind of in their day-to-day lives. And that's an important role for other professionals to play in communicating that with the primary care provider.
Yeah, definitely. What are some strategies early childhood professionals can use to collaborate with primary care providers?
Well, I think the first thing is knowing who the primary care provider is, right? So that's kind of the first step. And often it's just as easy, it's easy enough to ask the family, who's your pediatrician or who's your family practice physician? Who does your child go to for well child care? So even just knowing who that person is, and then reach out, call the front desk of that office, leave a message if you have to, ask to speak to a nurse. Sometimes you may not actually get to talk to the primary care provider themselves. You may talk to their medical assistant or their nurse or a care coordinator. But those messages and the communication that you have with those professionals will get back to the primary care provider. That might get documented in the chart or in some way to communicate with the provider, this is what's going on.
Yeah.
And, kind of along those lines, figuring out who is a good contact. Sometimes families know, right? Families ideally have a good relationship with not only with their primary care provider, but also other professionals within that practice. Like I said, there's almost always a nurse, a medical assistant. Sometimes practices have care coordinators, or Healthy Steps, the project or the program I direct, has integrated behavioral health clinicians who are providing support to young children and families in the context of that primary care setting. So figure out who's the best contact, who has a relationship with that family who also works in that practice, and who can communicate with.
Okay. Okay. Great. So, what does screening look like, and where is it happening within pediatric or family practice clinics?
So nearly all primary care practices are screening usually for development and autism. So using tools such as the Ages and Stages questionnaire or the MCHAT-R, uh, which is an autism screener. And almost all practices, so many, this didn't used to be the case, but many practices are screening for development. If they're not using a formal screening tool, all practices are doing at least surveillance, really monitoring that child's development. It's a critical part of what primary care providers do at each well child visit. So those things are happening frequently. And, sometimes practices are doing those every single time that child comes in for a well child visit. Sometimes they're doing them at least once or twice a year. And many practices are also beginning to screen for other things like social emotional development, more specifically, or other kinds of psychosocial or social determinants of health concerns. So things like housing insecurity, food insecurity, transportation challenges, things like that might be impacting that child and that family.
Yeah. Wow. That's amazing.
Yeah.
Can you tell us a little bit more about Healthy Steps and where it exists in Colorado?
Sure. Healthy Steps, as I've kind of alluded to, it's an evidence-based early childhood integrated program. And basically what Healthy Steps does is it takes a professional with early childhood and developmental expertise and it embeds them in the primary care setting. So that Healthy Steps specialist is able to support the practice with really providing enhanced care to young children and families in the context of where they're coming already. So it increases access to behavioral health and developmental support in the first 3 years of life. And the model is really prevention focused. So the idea being that we're supporting families when, they may be distressed about something before it gets to the point where we're worried about diagnosis, right? We're going to address concerns before they become crisis. So the Healthy Steps specialist and the primary care providers and the practices as a whole really work together to make sure that families are receiving the most comprehensive, high quality well child care that they can in the first 3 years of life. Healthy Steps, as I mentioned, it's an evidence-based practice. It exists all over the country. There are 240-ish clinics across the country that are implementing the model. And here in Colorado, we have 27 clinics that are implementing the model and really all over the state. So ABCD, as the state intermediary, has worked very hard to make sure that our growth and our scale here in Colorado is not just focused in areas that are urban and, kind of Denver metro area, but also that we have access to this high quality model for rural communities and communities that may not otherwise have access to these services. So we've got sites in Grand Junction, Fort Morgan, Brighton, a couple in Alamosa, Pueblo, soon to be Colorado Springs, and then quite a few in the Denver metro area as well.
That's great. That's awesome. All right. Well, do you have any other thoughts to leave us with today?
I think the main thing is just to encourage professionals to reach out to your primary care providers that are working with the families that you're working with. They want to hear from you. Again, it may not be the doctor that you talk to. In some cases, it might be, but many times they have support and other professionals within their clinic that you can talk to. Who does that family trust in that practice? And how might you connect with that person as well? Don't be afraid to reach out. As someone who works in primary care, I know that we love to coordinate with other professionals in the community and to help give us a really good understanding of what's happening with that child and family when they're not inside the four walls of our clinic.
Awesome. Thank you. And so for anybody watching who might have any questions, where can they go or who can they contact to learn more?
Sure. Well, I think you can visit our website, coloradoabcd.org.
Okay.
People are also welcome to email me if you have questions about Healthy Steps, how it works, where it is, how to coordinate with them. I'm your person to answer those questions. So my email is Melissa, MELISSA Buchholz, BUCHHOLZ @cuanschutz.edu.
Okay.
Or you could connect with our executive director, Eileen Auer Bennett, and her email is eileen@coloradoabcd.org.
Okay, awesome. We can add those into the description and so that everyone has access to that. Thank you so
Great.
much for your time today, Melissa. We'll see you
Sure.
all next time.
Thanks.
Bye.